Julie, you came to us back at the end of November of 2014, and you've been diagnosed with migraines and occipital neuralgia, is that correct? Tell us a little bit about your history of headaches. How long have you suffered from headaches? And
23 years.
23 years you've been a headache sufferer.
Yeah.
What types of medical help had you sought during that period of time?
I have had acupuncture, cranial sacral therapy, neurologist workups, any massage, anything that people would say, "Oh, this will help." Yeah.
And clearly, for 26 years, you've hit dead ends. Nothing's been able to help you.
Right.
So you've talked a little bit about you've had nerve blocks. So you had injections.
Occipital nerve blocks.
And that's helped a little bit, but the pain's always returned.
Right. They
It's
wear off.
fixed, yeah. It's symptomatic relief.
Right.
Medications. Your history. Tell us a little bit about the drugs you were taking, the frequency you were taking those drugs.
Over the years, I've tried most of the triptans. Switched back and forth. When one would stop working, we'd switch to another one. Currently, when I started coming here, I was on Imitrex, 100 milligrams, and if I maxed out on the Imitrex, I would take Fioricet.
Yeah, and you're taking Imitrex up to 13 times a month. Is that correct?
Yeah.
Wow. How did that impact your life over those 23 years of suffering?
I say that I didn't have to miss a lot of work. It had to be a pretty severe headache for me not to just fight through it and keep working. But I did miss a little bit of work, and it was more that I missed stuff at home. I'm thinking of the commercial you see where the kid yells, "Mom has a headache!" Because it's just like I just have to go disappear and go lay down or not go to some event because I just wasn't gonna be good company and I wasn't gonna enjoy it. So.
Yeah, that's horrible. So in addition to your migraines and headaches, you also suffer from neck pain, which is more frequent. You were having neck pain just about all the time, constant neck pain. So over the course of therapy with us, let's start with the neck pain, which was the more frequent pain. And so at the end of each day, that became debilitating.
Yeah, it was. I know my posture is part of my issue, and have a head forward posture, and trying to work on that. But at my desk at work in front of a computer, especially if I was working on documents on the computer for most of the day, I would have just burning pain in the back of my neck and my shoulders by the time I would get off work.
But after your 5 months of therapy here,
I think I've had one episode of that in the last couple of months.
That's
and
right.
It's made a big difference.
And then most importantly, from going 13 times a month taking Imitrex, how has that declined over the course of our therapy?
It's half. It went to half of that pretty quickly, and then now this month I've only had to take 3.
Yeah, you had one episode in the last, I guess you had 3 weeks off, and you had one episode, and now you've been 3 weeks again.
Right, 3 weeks again, headache free.
Headache free. So 1 in 6 weeks compared to a lot of months.
Yeah.
We made huge progress. What do you think has been the biggest part of your therapy that's contributed to the success of getting rid of these headaches?
I think the laser.
Yeah.
Because even when if I come in the morning and I feel a little something headachy, like the precursor, as soon as the treatment is done, it's gone.
Yeah. The laser therapy is fantastic, breaking that pain cycle.
Yeah.
So how do you think your life will change now looking forward, now that these headaches are becoming a thing of the past and the neck pain's gone?
I don't have to miss out on so much stuff.
And would you recommend any headache or head pain migraine sufferer to come see Office of Migraine Relief?
Absolutely, I have. Yeah.
Thanks so much. We appreciate it. We're glad for the success.
Thanks.